I now call on Richard Egan, who's our first speaker. Richard, there's a good biography of Richard in the program. I won't belabor you with a long introduction. I'll leave him to introduce the subject. Dr. Richard Egan.
Tihe Mauri ora, ko Michael Egan toko papa, no Tarawhiti ia, ko Kathy Egan toko mama, no Otatahi ia, ko Richard Egan aho, no Te Wanganui Atara aho, ka noho o ki Otapoti aene, tēnei te mihi ki koutou katoa, Mauri ora ki tātou katoa, tēnā koutou, tēnā koutou, tēnā koutou katoa. I'd like to acknowledge this place. I'd like to acknowledge the people who've come before us. I'd like to acknowledge the mana whenua and toa who's welcomed us and made this space safe for us. I'd like to acknowledge the university and the Salvation Army. I'd like to particularly acknowledge Maureen and Kaylee who've really made this happen and possible. I'd also like to dedicate this talk to a friend and colleague of mine, Julie, I'll call her, who I worked with almost 20 years ago. She worked for a mental health NGO as a survivor herself, and I was a mental health promoter back then. Together we developed a spirituality workshop for those experiencing mental distress. Julie's own mental distress was too much and she is no longer with us, but she would have been so excited about seeing this happening today. This is part of a quiet revolution going on. The fact that we're thinking and talking about spirituality and wairua in the academy is a quiet revolution. 20 years ago, we would have thought it'd be weird, strange, completely on the outer. But biomedicine is moving towards accepting and examining this. And that's part of what's happening today. I really appreciate you all coming. To help set the scene, I've been asked to help set the scene. My background, I've been a school teacher, I've been a mental health promoter, as I said, and now an academic. And I've always been interested in spirituality, personally and professionally. From a Catholic upbringing, I now call myself a cultural Catholic, but I have an active spiritual practice. I now work in the Dunedin Med School in Preventive and Social Medicine. My master's thesis looked at spirituality in state education, which there is some. My PhD looked at spirituality in end-of-life care. Since then, we've done all sorts of studies on aspects of spirituality and health, which I'll talk a little bit about later. My job, setting the scene today, is to suggest that there are many understandings and experiences of spirituality, perhaps as many as there are people. But there are commonalities. To give some sense of what we're talking about, I'm going to present what I call a framework to understand spirituality. This is naturally provisional and ever-changing. It also may seem that I'm reducing the irreducible, but I'm aware that spirituality isn't a piece of the pie. Rather, it's an integrated across all of our well-being. However, to examine it, to study it, and perhaps most importantly, to communicate its importance, we talk about spirituality in a discrete way. So this framework, it has 4 components, and I'd like to go through each with you. The first component, and this is kind of the ubiquitous thing that everyone asks, is what are you talking about when you're thinking and talking about spirituality? And this definition comes from Christina Pucholsky et al. There was about 40 people from 50 or 60 countries around the world that argued for 3 days in Geneva over this definition. I was lucky to be there. And it has these components. It suggests that spirituality is dynamic, so changing. It's intrinsic, so that everyone has a spiritual domain. It's about ultimate meaning and purpose, and for some people, the transcendent. And it's experienced through self, family, others, community, society, nature, and again, for some people, the significant or sacred. And it's expressed through beliefs, values, traditions, and practices. So that's what we call a summative or broad definition. Very hard to study if you're an epidemiologist or a biostatistician, but quite good clinically. We did, as I said, an end-of-life care national study, both qualitative and quantitative. And out of that work, we suggested this. And in fact, we called it a map of the terrain rather than a definition. And it suggested that we included ultimate beliefs and values, a sense of meaning and purpose in life, a sense of connectedness, which Dr. Pat Nata from the East Coast, that comes from him. He said I could talk about this using his name. He said, for many Māori, from his point of view, wairua or spirituality was about connectedness to the past, the present, the future, the seen and the unseen. I'll never forget him saying that. Also, we talked about identity and awareness in the work, and that for some people, these things are seen through the lens of religion. I'd like also to bring up Julia Liebrick, who I particularly think is a very important person in this area. Julia Liebrick was the first mental health commissioner, as I understand, and she calls herself a survivor. In an interesting document out of Australia, out of spiritual health in Australia, something called Heart and Soul Matters, and this is a guide for spirituality and mental health. She said in the foreword that the very word is enigmatic, and some people are more comfortable with the word religion or philosophy or cultural traditions. And she went on to say, what makes you feel whole, real and authentic? What makes you connected to others? What gives your life meaning and purpose? What gives you hope? Our answers to these questions point to what matters most in our life and to what protects us. Our inner strength and wisdom can be invaluable to our recovery and survival in times of distress, illness and crisis. So I'd just like to acknowledge Julie. The Australians are doing really well on this. Actually, they've got an organisation called Meaningful Age in Australia, and this is some of the resources that they produce out of that organisation, just to suggest what spirituality is, the scope, the breadth of spirituality. I'd like to. Those are free online. The other thing that I think it's important to put up front in terms of setting the scene is what is spiritual care. This comes from, again, from Australia's Spiritual Health Association, 2019 guidelines on quality spiritual care and health. And they've got two definitions, and I really like this. They've got a clinical definition, which you can read there, and they've got a consumer definition, which is about connecting with yourself, people, or something beyond. It may involve religious practice, but it may also be just what's important to you. It gives you meaning and purpose in life. There are many, many definitions around the world, both around spirituality and spiritual care. In fact, there's over 60 published definitions, but many, as I say, have these commonalities. The second component of this framework is the principles or models out of which we work. So what we suggest here is that the way you see the world, the way that you work out of a particular model of care or an ontology impacts on how you work. So, for example, thank you to Mason Jury in 1984, came out of the Māori Women's Welfare League actually, we have the ubiquitous Te Whare Tapawhā. This is since 1999 in the health and physical education curriculum. Every student in New Zealand who goes through the state school system learns about this. My 5-year-old built a tapawhā in the first week of his state school education. Our medical students all know this. And that's quite a radical thing, because there's been this movement from understanding health just as a physical biomedical approach to understanding at least physical, mental, social and spiritual. As Tor says, they're not quite sure how to operationalise it, but that's part of what we're doing here. The whānau whāle is one of the Pacific models of health and well-being. This comes from the Samoan model from Carl. And this is probably one of the best-known Pacific models, similar to tapawhā. Oh, incidentally, there's many other models, as you know, Te Wheke, etc. Within some of our NGOs, the Cancer Society has picked up on tapawhā, and in their supportive care approach, they're looking at the 4 domains. Hospice care, since 1968, they've been talking about spirituality in what they call a total care approach. It was one of the reasons I was interested in hospice, because they explicitly assess and address the spiritual domain in their care. And then this was one I found last year that came out of the Netherlands, a very secular country. And interesting, look at where they put spirituality at the centre of the same 4 model approach or 4 domain approach. So, if you think about the models or the approach, the principles that matter, we've gone from, or we're slowly moving from, what I call a bioreductionist approach, where we just reduce a person or a family whānau to their biomedical being, and there's a pendulum swing to this what is a long biopsychosocial, spiritual, or holistic, if you like, approach. And I think that movement is happening. I called it on the radio yesterday a quiet revolution or a quiet sea change that's happening. And I think it's partly because of people like Mason Jury and the indigenous ontologies, the indigenous worldviews that are impacting that change. So next in this framework to understand spirituality is the evidence. You'll know, particularly in healthcare, we're in a very evidence-based culture. I talk more about evidence-informed in this area, but I think it's very important for us to think about this. That graph there, that was in 2012, and it shows the publications of spirituality, religion, and health. And you can see the particular growth from about 2000. In preparation for this talk, I did a search on Web of Science. Actually, a librarian helped me do a search on Web of Science. And we looked at the studies that have been published on spirituality, religion, and mental health. And you'll see, again, from about 2000, they've increased, and that's now exceeded that 2012 number, just on spirituality and mental health. This is a growing area. One of the leaders in this area is a guy called Professor John Swinton from Scotland. He's actually going to be in Otago next year doing a summer school, is it summer school? Yeah, summer school paper on spirituality, religion, and mental health. But he wrote this book, and the subtitle of this book, you probably can't read it, and I can't read it properly either, but it's called Discovering the Forgotten Dimension. And I think that idea that spirituality is the forgotten factor within mental health is still relevant today. This was 2001. But I think that's slowly changing. This is the Journal of Spirituality and Mental Health, and there's 2 or 3 other journals that are particularly looking at psychology and spirituality, indicating or indicative of this change. One of the things I haven't done a formal systematic lit review for this talk, and I would love to do that. If anyone's interested in doing that, that'd be a great thing to do. But what I did is I drew on meta-analyses and systematic reviews that exist. This is probably one of the best ones, even though it's 2006. And what this woman suggested is that the religious evidence is very strong. It's much easier to measure things like church attendance and belief in God. And so there's very good religious evidence that particularly comes out of the States. And it shows that there's good associations with reduction in depressive symptoms, for example, around religious belief. There's some evidence around yoga and meditation, particularly qualitative research shown to improve mental health and reduce anxiety. And there's some PSTD literature showing that religion and spirituality is associated with improved traumatic recovery. In schizophrenia research, there's a little bit of evidence, and particularly it suggests that religion and spirituality play a role in, and I quote, reconstructing a sense of self and recovery. And other people have found research around schizophrenia and spirituality providing hope, meaning, and purpose. There's a little bit in here about the mechanisms, because that's an interesting thing, is what is the relationship between religion and spirituality, and how do those things how are they protective or otherwise? And it's interesting that there are a couple of things that are otherwise, and that it's not all positive. And what Corner suggests is that increased mental health problems are often found amongst those with a very strict religious upbringing. So that there is some relationship between religious distress and some mental health distress. We've found that in some of our research as well, that people sometimes feel guilt for what they've done, and there's a relationship between that and their distress or their illness. But that's still an area that could be examined in research. The other thing that Corner does is she talks about the limitations, and she says that although the evidence generally supports the notion that spirituality is beneficial for mental health, it does have some limitations. And interestingly, she says of the quantitative measures, they may not fully access the meaning spirituality has for the individual. So qualitative research will largely do things like, ask through a survey or an instrument what you think, in terms of trying to measure or understand your spirituality. What they're suggesting there that it needs to be balanced with the kind of qualitative stories that balance that. She also suggests that it largely focuses on mental health problems rather than mental health, good mental health. and that there's sometimes a blurring between religion and spirituality, and that's particularly the case from the American research. I'm just going to go through a number of the, is that the 5-minute mark? Thank you. A couple of areas around the evidence. First, there's I think, a really strong and important survivor voice. And again, I've quoted Julia Liebrick here when she was the Mental Health Commissioner. She talked about mental illness can lead to spiritual progress and ultimately to mental health. I thought that was really powerful. In terms of other qualitative studies, this comes from a systematic review of qualitative studies in 2019. I was excited to find that. And it talks about people who experience mental health difficulties, talking about 80% of them talking about the significance of spirituality. The quantitative studies, the trend, and we only talk about trends in quantitative research, the trend suggests that there's a relationship between higher spiritual well-being and reduction in mental distress. But there's lots of issues with it. And the limitations are particularly around methods, measurement, design. There's a lot of Christian bias, and I don't mean bias negatively. I mean that the majority of the samples are Christian. So there are some conflicting results quantitatively. So there's a lot of work to be done there. And then in the mental health professional area, I found another nice paper in 2019 that talked about the importance of spirituality that's been considered from people who work in mental health, but that to some degree there's a lack of confidence or competence or training in there. So that, as Greg said, the best of mental health professionals, psychologists, psychiatrists, counsellors, etc., have always done good spiritual care, but there isn't that much training either pre or in service. Thanks, Greg. And then I think the Māori contribution, Prof. Jury has been significant in this, but also Hukarere Valentine, who I haven't met but I really want to. She's written this great paper published in 2017 based on her PhD around Wairua and psychology. I'm going to rush through this now. I think social work has a lot to say here. Ron Patterson talked about spirituality coming up again and again in the Mental Health Review. There's an interesting study, a New Zealand study around faith and belief, and there's other literatures. I won't say too much about the mental health stats, other than we still say that at least 1 in 5 or 1 in 4 of us will have a diagnosable mental illness, however that's understood, and perhaps at any one time, and 1 in 2 of us over a lifetime. This is a very good paper if you're interested in further stats around that. I won't go through this, but we've done a whole lot of research around spirituality and other health outcomes, including some people who will speak today. But the ones that are in blue have related to mental health. I'd like to acknowledge Glenn Calhoun, who's been talking about this for a long time. He's a GP and a poet, and he says the spiritual life is the cheapest, most accessible, and most, after warm houses, good food, and clean hands. I really appreciate and acknowledge Glenn. What's happening is the evidence is such that it's impacting on policy, and there's a whole lot of documents around the world, and I won't go through them at the moment, but that are starting to affect policy, and I think we have to have, because policy gives teeth to practice, so we need the evidence impacting on the policy, impacting on the practice. I'd like to acknowledge the Mental Health Foundation this year, that they used Tapawhā as a framework for the Mental Health Awareness Week, and they had a whole day where they were talking about mental health and taha wairua. I'd like to acknowledge the Australian, they've just put out quality spiritual care guidelines for the whole of Australian healthcare system. So that's the evidence, and the Mid-Central Health District Health Board have done some great work, and I'd like to acknowledge them at a very high level. They've got a spiritual advisory group, and Manawatu are looking at a development strategy that uses Tapawhā and explicitly talks about Wairua, so I think that's an important component. Finally, the zeitgeist. That means the spirit of the times. Why are we talking about spirituality? Why is this the first time we've ever had a symposium on it? And I think there's a whole lot of reasons. One of the things is that we've got less religious attendance. For the first time in the 2018 census, people with no religion were more than people who were Christian. So 49% no religion, 37% Christian. So I think this is changing. We need to know and understand what's happening with what I call the forgotten 88%, the people who have got no explicit connection to church, synagogue or temple. think there's a whole lot of reasons around the zeitgeist. So I've talked about the low attendance, but the growing spiritual but not religious, the growth of mental distress, multiculturalism and pluralism. John Bluck talks about the spiritual vacuum in New Zealand. What fills what Lloyd Gearin says, the post-Christian age? What fills that vacuum? And then, of course, Mason Jury's contribution. Oops, sorry, I haven't shown you that. And then just today we've heard about the workforce being dispirited from the Senior Medical Association. And then, of course, the consumer voice that is demanding people think about and talk about this area. I think we need to acknowledge the treaty, and you could argue that not addressing spirituality in healthcare is not meeting our commitments to the Treaty of Waitangi. Finally, I think we need to think about the whole environment. It's all very well thinking about spiritual well-being downstream with our clients. If you aren't in an environment, a DHB, an organisation, an institution that supports that, then it can never happen properly. And I think we need to ask these big questions that this public health doctor asked a long time ago, Trevor Hancock. He said, why are we structure our society in such a way as to create ill health? And I think as part of that analysis, we need to think, what is the place of spirituality in a society that's structured to create health? I think, interestingly, Treasury, as I talked about before, that they've got indicators for well-being, and one of those indicators, I've been writing to them for years, is spirituality. They don't, at the moment, they've said how they're going to measure it to be developed, and it'll be interesting to see what they come up with. I won't go through this, but in the Australian National Guidelines that have just come out, they've got very clear guidelines, both organisationally and for people and culture. I think in New Zealand we need to develop our own way of doing this. So what can we do? I think that we can think about having more of these things. Maybe we need to do this every 2 years. I think we need to think about conscientisation, raising people's awareness of this issue. I think we need to become advocates and lobby and advocate with evidence-informed approaches. Every time I sit next to David Clark on the plane, I talk about it. I think we need to affirm Indigenous and Māori spiritualities. I think we need to integrate those spiritualities that challenge dominant paradigms. I think we need to affirm whole person and holistic approaches across disciplines, including spiritual literacy and vocabulary, and drawing on our religious spiritual colleagues, because there's a lot of spiritual literacy that we can learn from them. I think we need to work with our allies across disciplines, again with the wisdom and religious traditions. And I think we need to think about the spiritual domain explicitly as part of needs assessment, a part of planning, evaluation, practice and policy upstream to downstream, which we're now doing and teaching very briefly, but we're teaching them to our medical students. I think we need to work on ourselves and grow our own wisdom. The research always suggests that we need to think about the spiritual well-being of the clinicians, of the doctors, the nurses, etc., if they're going to address this with their patients and clients. And finally, and ultimately, I think we need to have a spiritual lens or analysis across all the things we do. I've run out of time. I've got hopefully about 10 minutes for questions. I really appreciate your attention. Kia ora. So if we've got any questions, if you could just put your hand up and we'll send you a mic. Or comments. Absolutely. We've got a nice system that's going to do that. One of the things I meant to say is that spirituality is a controversial thing. You know, there'll be people that'll be sitting out there now thinking, oh my gosh, he's full of it. But the reason that is that spirituality is about for many people, it's about really close to the essence of who we are. But there's some people who think it's a load of rubbish. And I think we need to recognise that whole continuum. So I just wanted to make that qualification.
I've read a research paper from an Australian, Brendan Hyde, and he does it with younger children. And he says one of the issues we have with spirituality is that we tend to trivialise it and it goes underground. And so we have no language or words to even talk about it, never mind use it in treatment or whatever. I don't know if you have heard anything of that.
No, I think that's very important. That was this concept of spiritual literacy. Because most of us aren't connected to a religion, we don't have a religious spiritual literacy anymore. But what's happening is that within our school system, and I've just been looking at there's some new NCEA approaches to looking at hauora and wairua and spirituality that is trying to improve, in a very inclusive way, the spiritual literacy of young people. But I think that's a really important component to this, because we need to think at the top of the cliff rather than when people fall off the cliff, but their well-being and their spiritual well-being. So thank you for that.
I'm next. I just wanted to make a comment and maybe invite a response from you. That graph where religious affiliation has declined, and and I remember the religious attitude survey, I think it was 2 years ago, which suggested that one of the key reasons why people are leaving religion is all the dogmatic sort of stuff, the problems that we've had, various religions. And I think that's significant for spirituality and the antipathy that many people have towards it. Often spirituality is seen as religion, and that's where the problem arises. And then for myself, speaking as a gay man, and the destruction that religions have imposed on not just gay people, but women, black people, the sin of Ham and all that sort of thing, right? Religion has been part of the problem, but also part of the solution. I wonder whether you can sort of say something about how we can move beyond that problem as it currently exists.
Yeah. So that's been an ongoing thing. I remember a professor in our department said to me about 7 years ago, she said, you really need to change your focus of research. Spirituality is not going to work. And I was like, I really respected her. But part of the problem there is around language, and Julia Liebert really, I think, touched on that as well. But I think we need to hold on to the word spirituality, partly because of Taha Māori, partly because of Pacifica, partly because of the way that it does resonate with many people. There's also some research that suggests for young people, when you talk about spirituality to them, they don't even mention religion. They talk about beliefs and values and a whole lot of other things. So I think there's an evolution going on. And the other thing, you talk about the relationship between religion and spirituality. I never, ever put down religion because this happens a little bit in the spirituality literature. Spirituality good, religion bad. I think that's too simplistic and too dualistic. I think what we need to evolve into something new that's better in both senses. So thank you.
Up the back.
I'd just like to ask, going on from your comment, in the Māori world there is so much respect for spirituality, but so much damage done by the conservative or the established churches. I said to one of my brother-in-laws once, do you think that when Christianity first arrived, the uptake was so big because there were so many things that resonated within it for Māori, and he has been very damaged and hurt and said, no, this wasn't going to be an option for him. And then yesterday I was at a Māori service, and they brought in, they did it from the other way, not from the Christianity have these things that are similar to Māori, but they did it from Māori have these things that are similar to Christianity. Could you comment, please?
I couldn't really, and I mean, perhaps Mark and Di might want to comment on that, because I wouldn't want to talk from the point of view of Māori. I think we have a lot to learn from Māori, and I think we're talking about spirituality, and our point of entry has been partly because of Māori. It's given us permission, and I think a commitment because of the treaty, but that's all. So I might let Mark and Di say about that. How are we going?
Up here.
Your phrase, religion, bad, spirituality, good. Is there a place within your definitions for bad spirituality? On some definitions that you've given, for instance, capitalism as a practice, as a set of beliefs and so on, and rituals could be a spirituality. What do you think of bad spiritualities?
So I think it's a good question, and I've thought a bit about that. I think there can be dysfunctional spirituality. So if you think about values and beliefs, I think it needs to be tempered with, for example, the human rights, the Universal Declaration of Human Rights. If you think about what we're learning, again, from Māori, and interestingly, that faith and belief study said that many people in New Zealand recognise the importance of spirituality, particularly related to mental health. But they also, and this was 1,000 people they surveyed, said that what we're learning from Māori spirituality is about the positive values. So I think that there's a series of positive values that are related to what I would call spiritual well-being, as opposed to dysfunctional spiritual well-being. The other thing that comes to mind there is that there are some that are often spiritual religious dysfunctions that impact negatively, and that was I was talking before about guilt and not being able to forgive, and some of those things that I've noticed, particularly in the end-of-life research that we've talked about.
Go ahead.
Can you come up with ideas to get the knowledge of this gathering to individual denominations, to get them to scrutinise their teaching for healthy or otherwise? There have been mentions of the homosexuality issue, mentions of women. We've got the Royal Commission going on. Yeah. There are any number of areas that need to be attended to if churches genuinely want to be good for people. You mentioned forgiveness. I've done a certain amount of work on the problems with current teaching, particularly for people who've been traumatised. So I'd just like your comments, please.
Yeah,
How do we tell the churches?
Yeah, the churches. I mean, I certainly couldn't talk, or speak on behalf of the churches, but I think the interest and growth in spirituality research and practice will have a, sort of a semi-permeable effect on the churches as well. And certainly my relationship with the Salvation Army has, I've really seen their openness to this sort of thing, and that maybe as we work more with the churches, that will happen. So I can't really answer that for you.
Any further questions? There being none, it behoves me now to just a small note of thanks to Richard for his presentation. You won't find any money in there, I'm afraid, Richard. But thank you for your presentation.